Guinea, West Africa. In March of 2014, the Ebola virus erupted, establishing its epicenter in the context of a healthcare system that was already fragile and fragmented. During this crisis, countless people risked their lives to care for the sick and slow the epidemic spread. Nevertheless, among the population, ultimately 2/3 of those infected with Ebola died. Faced with this staggering mortality rate, as the epidemic began to subside, health officials were rightly concerned that Ebola would have also affected routine health care. For example, they wondered if pregnant women were getting their checkups and if children were still receiving vaccinations. And so, public health professionals went in to see. One who took on this important task was Alamu Berry, a senior analyst for measure evaluation. When asked to travel there in early 2015 to assess Ebola's impact on the use of reproductive, maternal, and child health services, he didn't hesitate.
I am a public health professional. I know that being a health professional is already taking a risk. Knowing the mechanism of disease transmission, I had no special fear to go and serve. I responded right away. I'm willing to go to Guinea. I'm willing to serve, measure to serve my country. My goal was to lead the fieldwork implementation, making sure that everything is well prepared and oversight the data collection, making sure the data collected are good data. Collecting information about health system is vital. It allows, number one, to get a good sense of what's going on in the population being served. Number two, to monitor and evaluate health service being provided. Number three, to provide an alert and an early warning capacity to the system. Number four, to support the patient and the health facility management. Number five, to support or enable a good planning and to support and stimulate research and so on.
The assessment Berry oversaw was a collaborative work of the United States Agency for International Development in Guinea, its Washington office, and Measure Evaluation. It targeted 15 health districts comprising more than 62 health facilities and covered the country's 4 regions. Berry and others interviewed 200 health providers and data managers. They collected 15 months of data, beginning with the period before the epidemic and continuing through its early and advanced stages. And some of what they found was concerning.
The finding of the assessment presented in this report indicate clearly that we had a significant negative findings. There was an overall decline in services. Child health services were most affected by Ebola, especially for immunization, diarrheal disease, and acute respiratory infections. Stockouts of common medicine was an ongoing concern. 1/3 of health providers received no treatment in Ebola infection control and prevention.
Berry attributes these problems in part to incomplete public health messages and the community's lack of confidence that the government could control the epidemic. The government, he says, missed an opportunity to talk to the public, to dispel rumors. Things could have been done differently.
One of them would have been to look at the data and make them talk to us, to make sure that we are in a position to reduce or to destroy the rumors. One example I can give you is that they would have said 100% of those Ebola patients who passed away came late for care and never showed up, and 100% of Ebola patients who were cured showed up on day 1 or 2. meaning that an early care will definitely lead to a better outcome.
However, the news was not all bad. The assessment of Ebola's impact on use of routine reproductive health, maternal and child health services also showed that the health information system, that is, primary data collection and reporting from health facility to district level, was functioning, and health service delivery was less likely to be curtailed due to Ebola infection or fears of infection in public facilities than in private clinics. But the data collected did not get fed into the national system, and so they were never analyzed or used.
I have a mixed feeling, I would say. Number one, I'm quite impressed by the dedication and the commitment of the health providers to serve in such an environment. I was also happy to see that the primary data collection and reporting from health facility to the district was functioning. We were able to collect data over a period of 15 months for about 30 indicators, which was really a big challenge. We did it. And we have observed improved control measure being adopted and widely used an entry point at the health facilities. Conversely, I'm not that happy about the management of the epidemic because Guinea failed to address the epidemic right at the beginning. And secondly, despite all the efforts, the epidemic is still ongoing 2 years after the onset, making it the longest epidemic ever. And thirdly, I think the system failed to reach out to the private sectors and the traditional healers who can play a big role in referring people to the health facilities. For lesson learned, I would say number one, early care will definitely lead to a better outcome. Number two, more training is still needed for health professionals to help them provide a better care and protect themselves. Number three, focusing only on health facilities is not going to provide an early warning system. A community level surveillance system is needed to have an early warning system.
Global health experts agree that data are essential. They provide context for understanding health issues. They help reveal emerging and urgent health problems. They enable good planning and support further research. But to do any of that, data must be gathered for analysis, and most important, data must be used.
A silver lining for the country, I would say that it was horrible for Guinea, but it represents a wake-up call for the government and the Ministry of Health. It's probably the right time for Guinea to stand up and rebuild its system, assuming that they will learn from mistakes made to plan accordingly and come up with a strong and resilient plan.